Hi guys, it's Dr. Morales over here. I answered your questions. Thank you for making them. I have them all written down here, and I'm gonna review them right now and answer some of them to you in the video. But for the full answer, please look up your name in the sections of the Instagram and Facebook and private messaging that you sent us so that you can find your specific answer, because I answered all of them. So I'll go with this one first. Is plateauing on your healing journey a sign you need to start a new protocol? So it's definitely a sign that something's wrong, because you shouldn't be plateauing. Usually you plateau when there is persistent infection that's either causing persisting cells or biofilm, and that is the cause of why you're plateauing, because the treatment you're taking, it is not breaking through that barrier and the infection's just persisting and hiding, and as soon as you stop that treatment, probably you're not going to be plateauing anymore. You're going to be crashing. So plateauing is, in fact, to me, a sign that something is wrong. If the treatment is right, if all of those areas that you should be focusing on, like infection, biofilm, persisting forms, toxicity, and immune system, are doing fine, then you need to look outside that scope and maybe focus on environmental toxins, pesticides, or insecticides, or exposure to mold. Or maybe you just had a surgery, or maybe you're having some metabolic response to some injury, or you fell down some stairs, or you had an emotional breakup. All of these things are also factors to keep in mind when your treatments are not working, because believe it or not, those factors do matter when it comes to getting better. The rest of this response to UpDoc 1, please look it up in our question section. Next question is xAllison_sunshine. Do you use antiparasitics in your treatment? The answer is yes and no, because it doesn't mean that everybody has parasites, as some people think that's the case. I do see a lot of strongyloides, tapeworms, and I have to treat them. Obviously, when I have the patients that are testing positive for that, either I give them some detox agent that is going to help excrete those parasites in the stool, and then I will try to collect that sample and do several testing. We routinely do a lot of live blood analysis looking for parasites in the blood. We also do dark field microscopy, but I do a lot of stool cultures, PCR, and we try to get all of those parasites diagnosed so that we can give the patient the exact treatment. Now, that isn't the case of parasites, but in some cases, you can also use antiparasitics when you're treating anaplasma or persisting Lyme forms, because it's like using antifungals to treat Bartonella. There are certain antifungals that will be more effective for persisting forms of Bartonella, and also there are some antiparasitics that will be more successful in treating stationary forms of Borrelia than they are just treating parasites or treating any other bacteria. So yeah, we do use a lot of antiparasitic treatments. In cases where the persistence of the parasite is in the blood, we sometimes have to do something more harsh, such as the case where there is severe babesia that is not responding to artesunate, to artemisinin, coartem, and malarone or mepron. Then we have to do a red blood cell exchange, and that usually resolves the case of babesia in the persisting form. So next question, this is also Allison_sunshine, says 6 strains of Lyme, Babesia, Rickettsia, Mycoplasma, Bartonella, big viral load, having MS symptoms, fluid leaking from the ears. Which infection would cause fluid leaking from the ears? Also, what do you think of SOT therapy? Well, first of all, Allison, I'm sorry to hear about your multiple issues. In regards to the MS that you mentioned, the MS symptoms, I recently did a scientific review of 689 cases with neurological Lyme, and I found out that 11% of those cases were actually diagnosed with MS and not ever tested as or tried or treated as a Lyme patient. So if you put that in perspective, if you are having MS type symptoms, then is it really MS, or is it just the Lyme causing the symptoms? I think it's more the second. I'm gonna leave a link on your response on Instagram to a video where I discuss the 689 cases and how it's linked to MS. Maybe you'll like to hear about that. And in regards to what causes otorrhea, or the leaking of the ear, you have to first determine what kind of liquid is coming out of the ear in order to determine what is the origin of the liquid. Because, for instance, it could be pus, and it could also just be liquid from edema. This happens in Lyme. In the inner ear, there can be some edema areas that can kind of explode inside and cause liquid to come out. So you can test that liquid and determine what type of liquid are we talking about. Because in a more serious manner, if it's CSF liquid, as you're suggesting, then this is something that is very difficult and very important to diagnose quickly and sometimes difficult to treat. So you should get immediately tested for that. A simple way of knowing what kind of liquid is in there is by doing a glucose strip, testing it for glucose. If there's glucose, then it could be CSF, because that is one of the things you find in the cerebral spinal fluid. Also, you can test for beta-2 transferrin, which is another substance found in the cerebral spinal fluid. So if any of those appear, then you should immediately go to the ER and get someone tested. This usually happens when there is a leakage from the brain post-traumatic. So if you had an injury there, then for sure you have to test for that. And in regards to SOT treatment, I think it's great treatment, especially if the testing that they're doing for the SOT therapy is showing the exact strains that you're dealing with, because that's how SOT works, by individually treating some of the strains that you're testing positive for. But if you're not testing positive for those strains, then it's not going to work for you, unfortunately. And SOT in some cases is great, and in some cases it doesn't do much. And I see those types of results, not with SOT in particular, but with any treatment that we do. Some patients get better with some treatments because it's especially for the thing that the patient is affected from, and some patients don't have that effect, and that goes also for hyperthermia. Some people do great with hyperthermia because certain people have Borrelias that are sensitive to that temperature, but then some people do hyperthermia, they have Babesia, they have Bartonella, those are not thermosensitive, so they don't have that same result. Next question, Paloma22_90. It's a bit hard to get accurate testing for Lyme in the USA. Can I get tested in your clinic, or do I have to already have Lyme diagnosis in order to visit your clinic? The answer is that both the CDC and ILATS, they have established that the clinical diagnosis is the standard of diagnosis. It is the one that supersedes lab reports, because nothing can supersede our clinical judgment. And then to answer your question, is it's good to get testing, because testing confirms the clinical suspicion. But ultimately, sometimes testing is going to be negative and you're still not going to rule out the infection. So you have to see your doctor and make sure that your doctor is hopefully Lyme literate, and that should be enough to get your diagnosis. If you have the means to spend on a test and you want to do so, then by all means, there are several testing facilities in the United States, some in Europe as well. We use one here in Mexico that, to be honest, it is the same, if not better, than the ones that I have seen in the European lab facilities or American, and you're gonna save a few bucks. So it's definitely worth checking out. Next question, Solarix with 2 X's. Do you treat patients via Skype? In case somebody is impossible to travel, can you guide a treatment? So Solarix, I can, and I do all the time. I try not to use Skype or any of the video platforms, because it uses too much Wi-Fi, too much internet, and sometimes the internet can be slow, and you're gonna be looking at me, and then I'm gonna be stuck in a picture, and then you're gonna be stuck in a picture. So what never fails is telephone. I use a landline, and that gives me the ability to put the telephone down, put you on speaker, and in my computer display all of your information. Usually what people don't realize is that when we have some consult schedule, let's say it's for 5 o'clock, I'm gonna make sure I go through all of the information that you send me. So if you're sending me 200 pages of labs, I'm gonna go through everything because I'm OCD in that way. So you're gonna speak to me by around 6 or 6:30, and that's the only way that I am able to really discover what the problem is. Because if I don't see the full picture, then how am I supposed to guide you through a process, especially if it's long distance? So make sure that you send the most relevant things, make sure you send all of the information, and of course we can do the consult through the telephone line. And also, if possible, I prefer seeing the patient in person, because again, nothing is going to supersede the physical examination with the clinical diagnosis. So if you have the ability to come down here, have one consult in person, discuss all your problems, we do a physical examination, we draw some blood, we send it to the Mexico City lab, then that's your best choice. That's obviously the easiest. Then you go back maybe the next day, but you go back with a much more specific approach to your case, with me and having a bigger understanding of your problem. So I hope that answers your question. And ultimately, the best choice of treatment, if you can, because not everybody can, is doing a full course of treatment. It doesn't have to be here. If you're in Argentina or Colombia or Uruguay or the United States, Canada, Europe, if you have a doctor that can help you there, I can help you with the basics and have that doctor try to give you some of the more aggressive approach. If you can't get that approach because of the whole political problems, CDC problems or whatever, then you have to come down here. But you're going to get a treatment that is going to be a more thorough and more effective treatment, because it has to be intravenous. Remember that it's not the same doing oral treatments as it is intravenous. All of the time, intravenous treatments, I have seen a much better response, much better penetration. If we combine that with some of the alternative treatments, then we're going to see a much better result. And we shouldn't see patients plateauing with that. We should see patients actually in an upward trend all the time. And if it's not going in an upward trend, then something's wrong. So just to close this argument, if you are a not so difficult case, you can come down here, get some little treatment, and then some oral treatment to go, and it may be enough. But if you are a very difficult case, then I'm going to have to see you here, and I'm going to have to be assessing you here 2 or 3 times a week, and have to be adjusting treatments, because some cases are just very difficult. And the good thing about having people here is that when they're here, they're all mine. I have to see them all week. I have to see them for the whole month, and sometimes for 2 months. So I'm assessing everything, every single day, taking blood tests. How can I miss stuff? So it actually makes things easier for me and better for the patient. There's some questions here. There's a lot of questions. I really appreciate all the interest. Micaela, do you recommend steroids or pain medication when dealing with joint pain for Lyme? So I do not. I do not, because steroids are going to be anti-inflammatory, but they're also going to be immune suppressive. And if you're dealing with an infection and you give the patient steroids, then what is the purpose of getting that patient better? It's gonna be a band-aid, but in the end, it's more gonna be like throwing gasoline on a fire. You're gonna make things worse. I only use steroids on patients that have neurological Lyme, and there is a difference having neurological Lyme and having Lyme with neurological symptoms. There is a big difference, and I get asked this all the time, and I'm just gonna answer what the difference is. The difference is that with patients that have neurological Lyme, they get treatments, they immediately get worse. They don't respond the same as people that have Lyme with neurological symptoms. Someone that has Lyme with neurological symptoms, you give that patients the right treatments, and maybe they will herx in 4 to 7 days, but they will not herx on the first or the second day. And in contrast, a patient that has neurological Lyme, you give that patient treatments, and the first day he's gonna seizure. The second day he won't be able to walk because he'll lose strength on her legs or his legs. And on the third day, he's gonna have dysautonomic syndrome. That is kind of the type of differences that exist between neurological Lyme and Lyme with neurological symptoms. And in the cases of neurological Lyme, I do use steroids because in the study that I did, I was able to revise a lot of literature that was that is shared on things that you can do to reduce the inflammation and the encephalitis and the meningitis. And in those things that are there, one of the top things that you can do is precisely steroids, another is plasmapheresis, another is the right stem cells, and then immune suppressors in certain cases. So that is a very different approach that you need to use in a very difficult case of neurological Lyme, which we do see. So obviously we're always trying to help our patients, and they also get better, but it takes really a lot of effort. You mentioned here, I think that's it. Okay. So in just to give you more information on that question, because you did ask for alternatives for joint pain, there are some alternatives like cold laser therapy, PRP injections, stem cell injections, ozone directly to the injections, BPC 157, which is a peptide that I learned from Dr. Ken Holtorf actually, and those things are going to be helpful for the revitalizing and the joint regeneration. At the end of the day, joint swelling is leukocytes migrating there, so they're migrating there because of a reason. We have to find out what the reason is. And this is another question, Amelia. What can I expect entering remission? Is remission when my tests come back clean or when I feel better? Is there any possibility of relapsing after a clean test? So let me make this very clear. There's always a possibility of relapsing, okay? I know this as a former patient. You should know this as a patient. There's always that possibility. So that's why we always have to stay healthy, eating well, working hard, working on ourselves, improving our physical condition, improving our diet, working on our spirits, working on our mental capacities, not procrastinating, having a really healthy lifestyle. That's the only way that you can stay in remission for a long period of time. And even in those circumstances, you have, a breakup or a sentimental loss or a loss in the family or, something simple like falling down some stairs, and that could cause even pregnancy and injury and surgery. That could cause for a relapse to happen. So just be aware of that. You have no control over it. You have to live the present. You have to live the moment. You have to forget about all those intricate little things. And if it happens, it happens. I can tell you that when somebody is relapsing, it's easier to treat than when somebody is treating for the first time. So I hope that answers your question. It says here, what can you expect in entering remission? How do you know? So these are the 4 keys to being in remission, or this is how I know you are in remission. Number 1, because your symptoms are better, or they're not there anymore, or the majority of them are gone. Secondly, because your Lyme test or co-infection tests are testing negative 4 months after treatment. Third, because your CD57 cells or natural killing cells are improving and your numbers are now back to normal. And fourth, because you're producing now antibodies, you're producing immunoglobulins that you weren't producing in the past. And this tells me that the bacteria is no longer immune suppressing you. So keep that in mind. Those are the 4 things I always check with my patients. Next question, Jason Retnap. Can I get rid of chronic Lyme notoborreliosis only with keto diet, intermittent fasting, detox, and vitamin C? What are your thoughts on eliminating refined sugars, gluten, and milk? I'll start with the last first. You know, there's a lot of literature saying that bacterias, they feed on sugar, they feed on they feed on certain things that are you're gonna find even in lettuce or in carrots or in meat. And to be honest, you're gonna starve yourself first before starving the bacteria. The bacteria is always genetically modifying itself, and you know, you can't get rid of manganese, iron, and sugar because, you know, the bacteria lives on that. You have to, yeah, reduce dairy because it causes inflammation, reduce gluten because it causes also inflammation, and with that comes symptoms. But you know, don't get rid of everything, because then you're going to starve yourself, and then it's just going to take a bigger toll on you than it's going to be on the bacteria. In regards to, can you get better from neuroborreliosis only on these things, on these diets and detox? First of all, you need to make sure you're identifying that in fact it's neuroborreliosis. So you're doing a cerebral spinal fluid with CXCL13 in a collection to make sure that it is a neuroborreliosis, or otherwise it's just Lyme with neurological symptoms, and there is a difference, as I mentioned previously. So Jason, what I would do is first determine which one is the problem, because if it's neuroborreliosis, my answer is going to be no, I don't think you can get better with that. But if it's if it's just Lyme disease with neurological symptoms, probably, hey, listen, there are some people that have very good immune systems, and if you are able to improve that immune system and you do diet, exercise, and have a healthy lifestyle, yes, you might, and you could get better from chronic Lyme. That I agree with. Next question, Adi Duma, can Borrelia be ever killed on a chronic case? Yeah, of course. You can kill Borrelia on a chronic case, and that's just step one. Step two is killing the Borrelia's biofilm and eradicating the persisting cells. And then step three, you have to detoxify those things, because that's going to just cost you a lot of symptoms. And then step four, you need to boost your immune system or have some sort of immunotherapy. And if you do all of those things, you're going to get better, my friend. I guarantee you that. Next question, Patrick. Could you talk about the connection between rheumatoid arthritis and Lyme with co-infections? Do you believe proper treatment can put rheumatoid arthritis in remission? Well, first of all, Patrick, thank you for your question. Rheumatoid arthritis is an autoimmune condition that causes pain, inflammation, and swelling of the joints. And it can occur with or without Lyme disease. The other thing that can happen is arthritic symptoms or arthralgias. And arthralgias is the medical term for inflammation, swelling, and pain of the joints. And this is a very conventional and very common symptom that we see with Lyme. And in order to get better from that arthralgia or arthritic symptom, you need to first make sure that the infection is no longer active, or otherwise the infection is going to be present in the cartilage. When the infection is present there, leukocytes migrate into that region, causing edema, swelling, and that's why there's a lot of stiffness. And sometimes people will have joints that will get, you'll make a fist and then they won't open up, and then suddenly, boom, they'll open up very quickly. That is because there is arthritic symptoms or arthralgias in there. Not autoimmune, not rheumatoid arthritis, but Lyme-related arthritis or arthralgias. And the leukocytes, as long as they're present, is because they're dealing with infection. So you need to make sure you're dealing with the infection so the arthralgias go away. If you treat the infection properly, if you treat the Lyme, those symptoms of arthritis, they're going to go away, okay? And I think that's all for today. I'm going to send you guys individually answers for everything that I just said here today. They're going to be in Facebook, they're going to be in Instagram, they're going to be in the other private messages that you sent us. I really appreciate your questions, and I want to do this exercise more often. I hope you guys want me to do that as well. I think it's very cool for me to get to answer these in a more casual, as you see, way, and I hope that you get your answers and that you are happy with them. So stay tuned for next time, and thank you for checking us out. Good night.